This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Dr. Melinda Cooper, internal medicine, pediatrics, and primary care with Mon Health. And we'll be talking about well-child visits and primary care this morning. So let's welcome in Dr. Cooper. Dr. Cooper, good morning.
Good morning.
Thanks for joining us this morning. We'll get into the subject at hand in just a moment. But first, you must talk about yourself, at least for a minute or two this morning. Just talk about your background a little bit, where you're from, your education, how you ended up working with Mon Health.
I grew up in West Virginia outside of Kaiser and came to Morgantown for undergrad and stayed for medical school and residency. So I've been in the area for quite a while now. And I've been working with Mon for about 4 years now and working at their Wedgwood location and medical park office and really enjoying being able to do both pediatrics and internal medicine, but I've really loved being able to transition to more pediatrics while I'm here as well.
What interested you in pediatrics?
Oh, gosh, I was the youngest of 3 siblings, so I didn't have any younger siblings to get to play with, but I remember it always growing up and having a lot of cousins around and kids around at our church, and really just have always loved being able to be around kids and getting to play with them and, getting to just be silly and fun all day, and it's been great to be able to do that, taking care of kids now as well.
Let me ask you this question. Who are easier to work with, kids or adults?
It depends on the day, but a lot of times kids.
Well, I appreciate you taking some time this morning. So when I say a well-child visit, what are we talking about? What is a well-child visit? Is that just an old-fashioned or a new term for checkup?
Essentially, yes. We, at younger ages for babies, we do visits obviously more frequently than once a year, so we call them well-child visits instead of annual exams or things like that because we're bringing them in for a number of reasons. We are checking to see how their growth is, to see how they're eating and sleeping, to see how they're doing developmentally, if they're hitting their developmental milestones or if there's concerns for other areas of delay that we might need to do more to help with other interventions and things along the way. Also looking at immunizations, making sure we're up to date with age-appropriate immunizations and really just helping parents if there's any questions, too, with where their child is in terms of their growth.
Why is it important to have these visits on a regular basis?
Really important for a number of reasons, the biggest being that with anything that we're talking about preventative care, we're looking at being able to maybe intervene at an earlier stage. Let's say if we have a child with some developmental delays, it's really important the earlier we can get them in to have other evaluations, to work with a therapist that might specialize in, more dedicated techniques to help them get caught up, the better we can do to see the kid achieving their full potential.
Dr. Melinda Cooper is joining us this morning, internal medicine, pediatrics, and primary care. I would guess it would be the parent's job to schedule these visits, but who can schedule a well visit? Any
guardian, so they can call and schedule a visit depending on their ages. Like I said, they can call and make sure that they're doing that. We try to also, if we have families that are established with us, try to look and see if there's ones that may be due for that, and can also reach out, but primarily parents that are going to be calling to make sure they get them checked out.
What's the age limit? When we're talking pediatrics, what ages are we generally describing?
So newborn up until 18 to 21.
Oh, it goes that. See, I guess, I don't know. In my mind, when I think pediatrics, I think kids, up until the teenage years, but you'll see patients all the way up through high school and even into college?
Yes, yes. So any pediatrician is able to see a child all the way up until the age of 21, and then after that, then they transition. So usually between 18 and 21, if there's someone that does just dedicated pediatrics, they start to talk to them about transitioning to an adult specialist. I did both a combined pediatric and internal medicine, so I could see them indefinitely.
So you could see someone from, well, their entire life, I guess.
I could, or my entire life at least.
For yours. Dr. Melinda Cooper joining us here on Mon Health Talk this morning. Walk us through a typical well child visit. What will it be like?
So usually starting with just some basic measurements, that is their height and weight, taking the vital signs, but usually then talking to the parents if there's any concerns, checking to see if they're hitting developmental milestones that are appropriate for that age, doing an exam, checking to see if there's any other concerns in terms of risk factors, in terms of environmental things like the lead risk exposure, screen time, nutritional types of concerns. So really just trying to make sure that they're having healthy habits and we're helping them to do their best with their growth and development.
Dr. Melinda Cooper is our guest this morning, internal medicine, pediatrics, primary care with Mon Health. We'll continue our conversation after this quick break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Talking to Dr. Melinda Cooper this morning, internal medicine, pediatrics, and primary care. We're talking about well child visits and primary care this morning. So let's say you bring your child in for one of the well child visits. Everything goes perfectly. That's great. What if there are some things that are of concern? What are the next steps after that?
So the next steps would be either to do some additional testing or evaluations to see, for instance, if we have developmental concerns, we have some additional questionnaires that parents can fill out and complete so that we can kind of see if there's things that, if they are truly delayed in certain areas, then we could make referrals to other specialists, other therapists, or developmental groups. If there's other concerns related to like nutrition or things along those lines, so getting them in with someone that can specialize in dietary improvements or different things. So it depends on the concern, but really just getting a little bit more information and then seeing the next step in terms of what specialists we might need to see to evaluate them more.
A lot of times we, no offense, think of the doctor when we're sick and not feeling well.
Sure.
But so if your child is sick, not feeling well, can't go to school, obviously, are you bringing them in? Do you make an appointment? Can you do telemedicine? What kind of options are available there?
Ideally, if the kid is sick, I usually like to be able to see them in the office. I can do some telehealth visits, but it's obviously with a lot of acute types of things, looking at the throat, looking at the ears, and if there's an infection, it's more challenging to do with a telehealth type of a visit. But yeah, absolutely. We have some same-day appointments and can have sick visits, as we would call them, to be able to try to figure out what's going on with them.
Talking to Dr. Melinda Cooper this morning. What are some of those common childhood illnesses, sicknesses that you're probably going to encounter as a parent?
Though there's obviously all of the run-of-the-mill colds and things, but there's a lot of ones. Erysiola would be a common one that we see with rash and fever. The hand, foot, and mouth disease that we see a lot of times in younger kids. Of course, strep throat, ear infections are common things to see a lot, potentially sinus infections. So there's a lot of the similar stuff we get with adults, but there are some that we see primarily in children as well.
I guess this is one of those things you learn through experience with your kids. But is there a general rule of thumb to go to when it's a cold and something that the kids will eventually get over in a couple of days, or that threshold where I need to bring you to the doctor, need to come see you? Is there a general rule of thumb?
Yeah, depending on the ages, yeah. So if I have a baby, usually the first couple of months of life, if there's any fever, 100.4 degrees or higher, you like to see them. For older kids, though, if they're running fevers, those are very common with most of our viral illnesses as well. But if they're running fevers consistently for 3 or 4 days, it's usually time to see if we can take a look and find out if there's something more going on. Other things that I always tell parents to be concerned for is really, the biggest things that we would see kids hospitalized for would either be dehydration. So if they're not drinking well or eating well, going to the bathroom like they should, or if they're having any kind of really significant breathing issues, respiratory distress types of concerns.
Talking with Dr. Melinda Cooper this morning, internal medicine, pediatrics, and primary care. Got to squeeze in another break, but when we return, what about the adults? Yep, we're not off the hook either. We'll talk about that coming up other side of the break. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Dr. Melinda Cooper, internal medicine, pediatrics, and primary care. And Dr. Cooper, what about the adults? When should we come in for a well visit?
At least once a year for a well visit to obviously just do preventative things, check our blood pressure, potentially doing screening blood work, and seeing if there's other preventative tests or vaccines that we need too. How often do you meet parents who maybe have neglected their health, for several years, possibly? Mm-hmm. Let's just say a time. How about that? A time. But once they start having children and the kids are coming in for visits, they go back to the doctor as well. Is that common? It's very common. Yeah, I have a lot of patients in their 20s, 30s, 40s that haven't been to the doctor for a long time. Simply because they haven't had any issues. They've been busy with life and haven't had a need to. But, yeah, it's important to make sure that we take care of ourselves, too.
And you kind of got into it a little bit, but what's a visit like for an adult? Kind of like, is it much different than the kids' visit? I mean, obviously you're not looking for developmental things at that point. But
right. Yeah, not much different. Obviously, we're checking vitals, making sure there's not issues with blood pressure, things along those lines that we see commonly in adults. But yeah, doing some other screening tests and doing other preventative screening things for different types of cancers and whatnot. But also things like, even simply nutritional types of concerns, whether we're getting enough exercise, or having too much caffeine to drink, or things along those lines that we can do to maybe make our health even better.
Why is it important to establish that regular relationship or just a relationship with a primary care physician? I mean, I'm sure you've heard this before. If I'm feeling bad, I can always go to urgent care. I can go to the ER, but why have that relationship with a primary care physician?
I feel like it's always best to have somebody who knows a little bit about your history, who's already known you as a patient, who's known if there's other health issues that tend to run in your family, or if there's other, things in our background that could absolutely impact how we might approach those types of urgent visits. So it's always easier, I think, to be able to see patients that are well known to you for those sick types of issues.
And you may know the patient very well if they've been coming to you since they were a little kid.
Yes,
on up
possibly.
Through. What's the most rewarding, impactful part of your job?
Oh, gosh, there's a lot. But, I really just love to be able to have those that continuity with patients over the years and getting to see kids growing and changing, and getting to see that you're able to, make that impact and, make a difference in their life is just really rewarding.
I just thought of this question, and I don't think I've ever asked it. How do you find a pediatrician especially if you're new parents and you're having your first baby and you've been doing all the perinatal care and doing all that? But how do you find a pediatrician to go to? Is that something that can be worked out, arranged, or how do I meet you? I guess.
Well, so lots of different ways. Sometimes it's more of if they've got friends or family that have kids, they see who they like. Sometimes there's directories or things online. The American Academy of Pediatrics has a directory that you can find board-certified pediatricians in different areas. I know at the Mon Health Birth Center, they actually have now a pamphlet available for new parents that lists pediatricians and family physicians that do pediatric care. So a lot of different ways. I've had some parents that even before they delivered had come in to get to talk with me and meet me and to ask questions and see if I would be a good fit to be their pediatrician as well.
So there are multiple avenues there too. I guess the main thing would be just ask. Would be a good place to start? Yep.
And, I have appointments in my schedule. I know most pediatricians have availability where we keep spots dedicated for newborns because we usually like to see them within the first few days after getting out of the hospital. So usually just calling the office that you want to get your child in with and just ask about getting an appointment.
So where can folks go for more information, to get more information on primary care, more information about you, for that matter?
So through our website, monhealth.com/primary care, it has a whole listing of our directory and all of our different primary care offices, including mine.
And for folks who, again, if you haven't been to the doctor in a while, it's okay. You'll see them. You won't be mean, will you?
Oh, never.
Of course not. Dr. Melinda Cooper, our guest this morning, internal medicine, pediatrics, and primary care. Again, you can always get more information. Go to the Mon Health website about all of Mon Health's services, monhealth.com, and in this case, monhealth.com/primary care. Dr. Cooper, always fun to visit with you. Appreciate you coming on this morning.
Thanks so much for having me.
Absolutely.